Hello, it's Dr. Roberts. I just want to send out another message to you guys. It's been a while about what's going on in the office and what some of my thoughts are about what's going on in the world. It's probably different than anything else I posted. I just want to get some things out there. I haven't really thought about what I'm going to say. I have all these little sticky things I've written notes on. The things I'm going to talk about, if there's any links to any videos, any websites, any information I'm using, any articles, I'll try to put them below here and links to those. But with this time we've had lately, I've had some extra time, obviously, so I've been reading some books and watching a lot of information and videos and podcasts and things about what's going on, and wondering why I'm not as freaked out about what's going on as most people seem to be. And I've come to understand it's just my understanding, my basic beliefs on health, my core values of what is happening and how my mind grasps and processes all this information. Some things that I've done recently that have got me to do this post right now is I just read a book by Dr. Pat Gentempo. He's a chiropractor that has multiple businesses, invented technology. He's actually the co-inventor of the Insight subluxation station, the scanning technology I use in the office. And he just wrote a book called Your Stand is Your Brand. Great book, kind of about branding and business, but it's beyond that. It's about how to figure out what your exact core beliefs are, dilute or get those down, distill down to exactly what you are, put that out into the world, take a stand on it, and you'll attract the people that resonate with that, and that can be your tribe to build your brand and your business from a pure place. So from that, and then some other friends I've posted, I've had some trouble recently with all the changes with the masks and that kind of stuff and what I want to do with that, but then it seemed like the universe has been talking to me. My mentor, friend, amazing chiropractor, Dr. Fred Schofield, put a post out the other day that hit me really hard. Dr. Devin Vrana, another amazing female chiropractor, that posted something the other day. So because of those things, I decided I need to take a stand and get out some information. So this is kind of what I'm going to talk about. There's a couple questions that I wanted to bring up that quotes that pop in my head, and I didn't realize they were both from Albert Einstein, but they're kind of ways to understand like where you are as far as accepting what's going on in the world or being fear-based about it. I think before that I'll talk about, the model of health that I process everything through is a salutogenic model. Salutogenesis is the celebration of health and doing things to foster and build up your health instead of pathologic paradigm, which is symptom-based, fear-based. Everything, germs are bad, the world's bad, it's scary, you got to take drugs and surgery and everything to stay healthy. Whereas salutogenic model is you're born healthy, you have an amazing ability to heal and perform, you just need to do things to foster that. It's, like I said, not fear-based. So the questions I have are, is the world a loving or a hostile place? So that's just from every situation you have in your core beliefs is just to believe, is the world loving or hostile? That's, and you can have either one and have reasons for that. It doesn't mean it's good or bad, just you need to understand where your mindset is. And there's also from Einstein, there's two ways to live your life, as though nothing is a miracle or though everything is a miracle. So with those two things, you can judge, you can believe those, either one, it doesn't matter. Just know that and know that's part of who you are, and you can base decisions with more logic and reasoning behind your mindsets. Or if you come up with one of those answers, you don't like them, you can change them and look into ways to look at the world as more loving and everything's a miracle. So we've seen a lot of crazy stats, deaths in this country and in New York and around the world from this COVID-19. New York has some scary things going on, lots of deaths and everything else, sicknesses, and they're overwhelmed, and trailers full of dead bodies and all that we're seeing, and it's still going on. I was watching a podcast. This one, I think it was Dr. Dale, not Dr. Dale Bigtree. He was a producer from the Doctors television show, and he's done a couple of documentaries. He's an amazing guy. I think everyone I'm talking about I actually know and actually met and spoken with. So these people I trust. So Dale interviewed some PhD engineer, systems engineer kind of guy, and he said when they do systems analysis for the country and the world on whatever, they throw out New York because it's such a oddity that their stats don't match anywhere else in the world. So that's one thing to look at. You can't project and equate what happens in New York to Wyoming or the Bay Area or other places around. There's different things that are going on there. The way they live, stacked on top of each other. They're indoors all the time. There's different things that are going on than other places in the country. Other thing is we're finding in Italy and in New York. In Italy, I think they're finding 99% of the people that died had comorbidities, other things going on. It doesn't mean coronavirus was the last thing that took them out, but it goes back to the salutogenic model of being healthy and fostering your health. And they found only 12% of people actually died of just the coronavirus. And in New York, it was 95% have comorbidities. Other things like diabetes and high cholesterol and heart disease and things like that are on top of this. And that's, the other thing that we're talking about. Sorry, I'm kind of going through this stuff. We're also seeing, which makes no sense to me with what's going on, the new information we're finding out is the death rate is much, much lower than we thought at the beginning of this, but they're making more draconian laws and orders on having to wear masks in public and things like that. And we know these things, do nothing. They're just for an optical illusion to make people feel safer. A study at USC and looked at LA County, and what they found was 4.1% of people they tested that with no symptoms already had antibodies. So that increases the number of cases in adults in LA County to 444,000 people, which is around 25 to 55 times higher than what they're saying. So 25 to 55 times more people have been exposed and have had this than they're saying. So that means the death rate is 25 to 55 times less than what they're saying at the beginning, which was around 3% when this first all started. There's another study that came out of Stanford that looked at Santa Clara County, and it came out to about 50% more cases than were thought. So they show a 50 to 85% greater number in Santa Clara County. So again, 50 to 85% less death rate. There was another study by independent group, Code Corporation, and there was Peter Richterich, something like that, Richterich. Theirs came out to 50 to 100 times more people have been exposed to this and had it than have been tested. And so the death rate is really coming out to about 0.12 to 0.2 and not the 3% that was original. The average flu season has a death rate of about 1.2%, sometimes it's even 0.3, 0.4% in a very bad year. So it's right in line with that. So we should be asking the government, what is the death rate when they'll let us go, when they'll reduce this thing? That should have been said from the beginning. Is it 2%? We're cool to let people start getting back to work, and definitely quarantine those who are at risk. I'm not saying, don't take care of people, don't be concerned about people, but people that are at risk, they can self-quarantine and other people can start to get back to normal life. Is it 0.5%? Is it 0.3%? Where's that line? We need to know that, and then when we reach that, we need to be starting to ramp up society and get back to working. This was on Dale Bigtree's High Wire. I'll put this in the link. So there are 856,000 plus people have been tested and have positive for the infection. If we use a 50% or 50 times increase in what have actually been exposed to, That comes out to 43,298,000 plus. And that comes out to a death rate of 0.11%. And that's in a higher range of 50 times. So if we go down to the bottom range, what these three studies are showing is a 25 times greater infection rate. It comes out to 0.225% death rate. Like I said, the average flu season is 0.13%. So we have all these things going on, and there are to be concerned about, but we need to find out where our safety is, where we can come out and just live our lives and be not so fear-based. And if they do start to release us from these, stand in place and quarantines, you can still stay home if you're scared. It doesn't mean you have to be forced outside. You can take any precautions you want, but we need to know the stats. They're basing these reactions to what's going on the old stats. Things are changing daily, and we're finding out it's not as severe and not as scary as originally said. They're also finding out that they're padding the books as far as the number of deaths. They're being told, a doctor I saw an interview with, he's actually a Congress or senator, said they're being told to say it's COVID death, even if it's just associated with it. So you can die of stage 4 lung cancer you've had for years. If you test positive for COVID, that's what they put on there. And he said he's never seen that in his 30 years of being a doctor, that the CDC is telling them what to put in death certificates. And they get paid more based on this too. So hospitals are empty right now for the most part, down 30-50%. Doctors are being laid off, nurses are being laid off, respiratory therapists are being laid off because they're not busy. And Medicare's reimbursement is about $9,000 for someone who has pneumonia. If they code it as COVID, it's $13,000 reimbursement. And if they are put on a ventilator, it's $39,000. So the higher ups in the financial parts of hospitals are pushing to have these stats changed, or these things changed to different diagnosis codes to get higher reimbursement. And we're also seeing some information coming out about doctors, respiratory therapists saying, people being put on vents might not be the best thing to do, or they're doing it too late or not the right type. They could be using CPAPs instead of intubated, enforced air ventilators. I was Dr. Kyle Siddell. I'll see if I can find that link. Did an interview about that. And what he's finding is this isn't like a pneumonia. People's lungs are congested and not able to get oxygen through, so you need to force oxygen. They're finding it's like hypoxia, like high altitude sickness. Like if you took someone and dropped them on the top of Everest and they didn't have time to acclimate on the way up, and that's what they're looking like. I think these numbers might be wrong. I'm sure I'll get in trouble, but I'll try to correct it. I think it's about, your oxygen level is about 40%, or in the air it's about 40%, and at high altitude it's about, like at Everest it's like 12%, and that's what people are showing symptoms of is hypoxia. So the ventilators aren't working the way they're being used. They're even showing that they might be doing more harm than good in certain people. And you also might be noticing they've started to switch. They've said about, people being sick, and now the people that are healthy, that are out there that are showing no symptoms, which is 50+% of people have no symptoms, they're starting to make them the bad guys. So you have no symptoms, you're out in the public, you're the ones that are causing the problem because you're healthy. So the healthy people are being made out to be the scapegoats and the bad people. The people that are healthy that show no symptoms are the ones that should be scorned and are getting ridiculed because we're the bad guys because we took care of ourselves and have no symptoms and are out there spreading it to people that are at risk. There's also some information from Dr. Shiva. He has multiple PhDs. He invented email, and he has some good thoughts about what's going on here. So I'll put links for him. Dale Bigtree from Highwire. Robert Kennedy Jr. has some good information. So I'll try to put all these links in here. This is getting long, so I'm going to wrap it up. But I just want to put this out there, other ways you can look at this. I know the media and the stuff I'm looking at is different, and I finally realized that the stuff I'm seeing is different than what most people are seeing, and maybe that's why I'm not as fear-based and not as afraid of what's going on. Hopefully this helps. If you have any questions, feel free to ask. If you think this is helpful, please share it. Thanks.